Hi. In our previous session, we had seen about the personal and the social adjustment. So, today's topic is guidance and the counseling. That comes under the mental health and mental hygiene. First of all, what do you mean by guidance? Guidance means it is the process of helping an individual to understand themselves and their world. It helps to understand first of all themselves, then surrounding world. Next, counseling. Counseling is defined as a face-to-face relationship in which the growth takes place in the counselor as well as the counseling. Here what happens in case of counseling, there will be the face-to-face relationship. Then the growth happens in the counselor and counseling, both they will get the benefit. What is the need for guidance and counseling? It helps in proper choice of lifestyle. Whatever we choose, whether it is happy or sad, in order to adapt to our new lifestyle, it helps in the proper choice. Helps in total development of the individual. Not only in one aspect, it covers all the aspects like physical, mental, emotional and spiritual. It develops the readiness to face the new challenges. Whatever in our life, any new problems comes, it helps in achieving that goal so that we can face any new challenge. It motivates the youth for the self development. Some people will have the fear in their inner mind, so they can't express themselves. So with this guidance and counseling, it helps to motivate the youth, save the young generation from the stress. Here what happens in case of studies and exams and all, the students will get easily stressed. So this guidance and counseling will help us to reduce that stress. What are all the types of guidance? Educational, occasional, social, health, personal and moral. In these all aspects, the guidance will be given so that they can accomplish their goal easily. In case of educational, if we guide the student to choose any course or to complete the exam so that they can score more marks, that guidance plays a major role in case of educational purpose. Coming to the health, health in the sense it develops the person's mind maturity and helps us to perform the task easily. Types of counseling. Types of counseling in the sense crisis, preventive, developmental, facilitative, individual and group. Preventive in the sense, in three aspects we need to cover: primary prevention, secondary prevention and the tertiary prevention. Developmental area from childhood to the geriatric age, in all the ages the counseling requires. Individual counseling, if the person is having stress in case of business or office areas, the individual counseling helps to reduce the stress. Group counseling, in order to motivate the students to get proper marks in the exams, we need to give the group counseling. What is the main difference between the guidance and counseling? The guidance will be given in groups, but the counseling must be given individually. Here, in case of guidance, the face-to-face relation is not essential, but in case of counseling, compulsory we need to sit face-to-face directly. Here in the task of guidance is not as serious as that of counselor, but in case of counseling, the task will be considered as a more serious. The cordial and satisfying relation is not needed, but here the relationship is needed, because in order to develop the trust, here in case of counseling, trust must be developed. So the relationship is needed. The guidance is considered as a broader and comprehensive because it covers all the aspects, but in case of counseling is depth and narrow aim to solve the problem. That is the main differences between the guidance and the counseling. Next we will see about the phase of counseling. Here first of all appointment. Next we will see about the phase of counseling: appointment, assessment, diagnosis, setting goals, intervention and termination. How the counseling process works? First of all, appointment is the main task in case of counseling. Then assessment. What is the individual problem we need to assess first. Then diagnosis. according to the person's condition, we need to diagnose the thing, whether it is a disease condition or any other psychiatric illness. Like that, we need to diagnose the thing. After diagnosing the situation, we need to set the goals, how we can counsel them easily so that they can rid of that problem. Interventions. The nurse need to formulate the interventions, how, in what way the process get be done in case of counseling. Interventions in the sense, we need to formulate some procedures so that we can counsel them easily. Finally, termination. Here, if the problem solved, we can terminate the counseling and we can start the new procedure. Otherwise, the follow-up may be advised for the further counseling or the future purpose. These are all the phases of counseling. So, in this today's session, I am going to end this mental health and mental hygiene with the guidance and counseling. Thank you one and all.